Welcome back, dear friends and students. We have already started with chapter number 4, reproductive health. In this reproductive health, we have discussed a general introduction of reproductive health. What is the definition of reproductive health? The purpose of reproductive health, how we control, and we have already started different methods of birth control, or you can also call it as contraceptive methods. Okay, 5 of the methods of these have been finished and we have to go ahead. But before we start, the another methods or whatever the methods of contraception have been left, we just revise the names of contraceptive methods. So what are the different names of contraceptive method? The first method of contraception is physical barrier method. Which one is a physical barrier method? In physical barrier method, condoms, diaphragms, cervical caps or what has been used which act as a physical barrier to prevent a meeting of sperm and ovum. Second, a similar method, instead of a physical barrier, here we are using a chemical. So this is called as chemical barrier method. With the use of chemical, we achieve the same goal. We prevent a meeting of sperm and ovum. Usually the chemical which is going to be useful is a non-oxynol 9. Okay. The third method which is useful, okay, and this is called as IUD. The full form is intrauterine devices. Okay. So these are the devices which are kept by an expert medical professional or nurse into a uterus that prevents a conception or pregnancy. Okay. The fourth method is oral contraceptive pills. This is the fourth method, oral contraceptive pills. The fifth method, it's called as injectables or it's called as implants. In oral contraceptive method, we are consuming or we are giving a tablet in the form of a pills or that is taken orally that prevents a conception. These pills contain either estrogen only or it contains estrogen progesterone in combination. And we are also giving the injectables and implants. The injectables and the implants, they are containing the same chemicals or the drugs, but they have a long duration of actions, so that doesn't has to be taken consecutively or repetitively. Okay. So this much methods we have finished. Today we have to discuss this method. This is the 6th number and it is called as surgical method. And the one more method that is left, it is called as a natural method. Okay, so today we have to discuss these two methods, a surgical method and the second one is called as a natural method. So let's discuss one by one. First of all, we start with the first method. This is called as surgical method. Okay, the name itself suggests what it is a surgical method. Surgical method, that means here the surgery has to be performed. Okay, and due to surgery we prevent a transfer of gametes. These surgical techniques, what we are using, they prevent transfer of gamete, means transfer of male and female gamete, that is prohibited or prevented with the help of this surgical method. Okay, the surgical method in a male which is performed. Okay, the different kind of a surgical method is performed in a male and female because the reproductive structure of male and female are different one. Okay, so the surgical method which is performed in a male, it's called as vasectomy. Okay, what it is called? Vasectomy. Surgical method performed in a male for contraception, it's called as vasectomy. And the surgical method which is performed in a female for contraception, this is called as tubectomy. Okay, what is called? Tubectomy. Okay, so tubectomy is a surgical procedure performed in female for contraception, means for birth control, and the vasectomy is a surgical procedure that is performed in a male for contraception or as a birth control method. Okay, so what we have to do, we learn it one by one. See what in vasectomy it has to be done. You know the structures of male reproductive system. It consists of a pair of testes, two testes are there. From that there are different kind of accessory ducts arise, and one of the accessory duct that is arising from it, this is called as a vas deferens. This is a tube. I am not drawing the whole structure. This is a urinary bladder. The vas deferens, it makes a loop over a urinary bladder. Okay, and it combines and finally it passes. I am just drawing the schematic diagram. Okay, so see what in a vasectomy has to be performed. In a vasectomy, the vas deferens, this is a vas deferens. Okay, vas deferens is going to be cut and tied. Okay, it's going to be cut and tied. Okay, so what happens here? The sperm which is going to be produced by testes, it does not transport. That transport process is going to be prohibited. The transport of sperm through vas deferens is going to be prohibited or prevented because we have tied and cut the tube. Okay, we have cut it. Okay, and then we have tied a knot, and due to that, the ovum cannot, sperm cannot travel. Okay, and this procedure is called as vasectomy. The cutting of this vas deferens is done by entering through a scrotum, a pouch-like structure where these testes are present. Okay, so through a entry into a scrotum, a vas deferens is cut and then they are tied, and thus ultimately it prevents a conception. Now, the surgical procedure, a similar surgical procedure which is performed in a female, this is called as tubectomy. So, what in a tubectomy has to be performed? Assume that these are the ovary. I am just drawing the schematic diagram. Okay, and it is a fallopian tube. This is a uterus, cervix and vagina. Okay, these ovaries are attached to the wall of a uterus and the pelvic cavity. Now what happens? You know that every 14th day, the ovum gets released. Every 14th day of menstrual cycle, the one ovum gets released, and the process of release of this ovum is called as ovulation. This ovum is usually transported through a fallopian tube. This is a fallopian tube through which the ovum which is released, that is transported. Now what we are doing in this process, we are cutting this fallopian tube and we tie a knot, we cut it. Okay, so when we cut it, the ovum which is released, that cannot be transported. Here the transport takes place, but that transport does not take place, and hence the fertilization, implantation and the pregnancy does not occur, or the lady does not conceive, because the tube through which it is transported on both the sides, the tube which is helpful in the transport of an ovum, that is going to be cut and tied. That's cut and tied, and this process is called as tubectomy. Okay, this cutting can be done by entry through an abdomen or by incision on an abdomen, or by entry through a vagina. Okay, so this is a vasectomy which is performed in a male. This is tubectomy, it is performed in a female. In a vasectomy, the vas deferens is cut and tied by entry through a scrotum that prevents a transport of a sperm. In tubectomy, the fallopian tube is cut and tied that prevents a transport of an ovum. This tubectomy is performed either entry through an abdomen or through a vagina. So this is a process called as vasectomy and tubectomy, that is performed in a male and female respectively. Okay. Now what is the advantage of this method? The surgical method. In surgical method, the chances of failure of this method is very less. Okay. So this is the advantage. The chances of conception is almost zero because we have cut the tube which is responsible for transport of gametes. Okay, so the chances of failure is almost nil. But what is the disadvantage of this method? The disadvantage of this method is that its reversibility is poor. It is irreversible. Once the tube is cut, it is very difficult to join, or it is, I think, almost impossible to join this tube because this tube are very small, like you can say they are thin like a hair. Okay, so it's very difficult to connect this tube. So their reversibility is poor. That means they are the permanent methods of contraception. They are the permanent methods of contraceptions. They prevent birth control. That means they are useful. They are useful for permanent contraception. Okay, their reversibility is very poor. Okay, or it is irreversible. That is the disadvantage. But again, the advantage is that the chances of failure of this method is almost nil. So this is called as surgical method. Okay, clear students? So we have discussed this surgical method. We have finished first 6 methods. Okay, now the last methods of contraception that remains, and that is called as natural method. So now let's discuss the natural method. Natural method. See, this is also called as traditional methods which have been performed from a long year ago. So these are a natural method, no use of anything, no use of any physical barrier, no use of any chemicals, no use of any contraceptives, oral contraceptives, or no use of IUDs, or there is no surgical interventions, nothing we are using. Okay, it's performed naturally, so that's why they are called as a natural method. Okay, so natural method of contraception, that includes 3 methods. The first one is called as periodic abstinence. The first natural method is periodic abstinence. What is a periodic abstinence? Periodic abstinence means in this method a couple remains away from a coitus, or they stay away from a coitus, means sexual intercourse, from day 10 to day 17 of menstrual cycle. They remain away from sexual intercourse between these 2 days. Okay, so they don't perform the sexual activity during day 10 to day 17 because these days are considered as fertile days. During these days, the chances of conception and chances of pregnancy is very high. So during this day 10 to day 17 of menstrual cycle, a couple remain away from sexual intercourse or a coitus. Okay, why these are the fertile days, or why these days has the most chances of conception or pregnancy? Because on day 14 there is occurrence of a ovulation, means a release of ovum. Okay, and for fertilization to take place, the meeting of sperm and ovum is necessary. Then and then the pregnancy occurs. So on the day 14th the ovulation takes place. Okay, so on day 14 there are very highest chances of conception. But you know that the menstrual cycle may be vary from 28 days, 29 days. In some women it may be at 26 days. It is considered as a normal. Okay, so plus or minus 2-3 days are considered as a normal. So we are also taking a range instead of just saying a 1 day, because it may vary. So we are taking 3 days on both the sides of a 14th day. And so now the range becomes a 10 to 17 days. Okay, so they are called as fertile days, during which the chances of conception or chances of pregnancy is very high. So in this method, during this period, a couple remain away from coitus or you can say a sexual intercourse. Okay, this is called as periodic abstinence. A second method is called as withdrawal, or it can also be called as coitus interrupt. Okay, the second method is called as withdrawal or coitus interrupt. What is called as in a withdrawal? In a withdrawal, the male partner withdraw his penis from vagina just before ejaculation, means a release of a semen. That process is called as ejaculation. So before the release of semen, the penis is withdrawn from a vagina, or male partner withdraws his penis from a vagina. Okay, so this is called as withdrawal, or it is also called as coitus interrupt. As the penis is withdrawn from a vagina, the semen does not deposit into a vagina, means insemination process does not occur, and the chances of fertilization and pregnancy are you can say less. Okay, there is not zero or almost not nil, but there is less chances of conception or pregnancy. This is called as withdrawal or coitus interrupt method. The third method, or third natural method, is called as lactational amenorrhea. Okay, lactational amenorrhea. You know the meaning of amenorrhea. Amenorrhea means absence of menstrual cycle. This is called as amenorrhea. Okay, and lactation, you know that it is a nourishment to a offspring or the baby in the form of mother's milk or lady's milk. This is called as lactation. Okay, so it is called as lactational amenorrhea, means absence of menstrual cycle during the lactation. Okay, now we know that absence of menstrual cycle, when it occurs, we have learned that the absence of menstrual cycle, it indicates a pregnancy. So in a pregnancy, the menstrual cycle stops. Apart from that, after a pregnancy, means after a parturition, after delivery of a baby, the lady starts to secrete some milk from a mammary gland for the nourishment of its baby. So until the lady feeds her baby intensely in the form of mother's milk, at that time the menstrual cycle does not occur. And as the menstrual cycle does not occur, the ovulation process does not occur, means a release of hormone does not take place, because ovulation is a part of menstrual cycle. And so ovulation does not take place. Ovulation does not take place means fertilization does not occur, and ultimately a pregnancy does not result. Okay, so this is called as lactational amenorrhea. So what is a lactational amenorrhea? After parturition or after delivery of a baby, the time period for which the lady feeds her baby intensely, till then the menstrual cycle does not start. Okay, so the sexual activity or the coitus during this period doesn't result into a pregnancy. So this is another method that is called as lactational amenorrhea. But one thing has to be kept in our mind, that this method can provide a protection for maximum 6 months. This is the maximum time period after a delivery of a baby for which it can provide a protection. Okay, and this is, I again repeat, this is the maximum limit. Okay, so it's a lactational amenorrhea provides a maximum of 6 months of protection after parturition or delivery of a baby. So these are the three natural methods: periodic abstinence, withdrawal or coitus interrupt, and third is called as lactational amenorrhea. I just summarize in a 1-2 line. In periodic abstinence, the couple remain away from coitus from day 270 of menstrual cycle, because they are the most fertile days. Second, withdrawal or coitus interrupt, in which the male partner withdraw his penis from vagina just before ejaculation. Okay, that means a release of semen. Third, lactational amenorrhea, that means up till the or until the lady feeds her baby intensely. During that, the menstrual cycle does not start, and so that's why there are less chances of conception, and it can provide a maximum protection up to 6 months. So these are the 3 methods. So these are the natural methods of contraception. What is the advantage of this natural method of contraception? The advantage is that there is no need of any kind of a material, no need of any physical barrier, chemicals or IUDs or pills or tablets. Nothing is required. It's a natural method. Okay, so there is virtually, you can say that there is no side effects associated with this effect, or you can say there are few side effects associated with some of the methods, but with natural method there is no side effects associated with it. Okay, so this is a natural method. But the disadvantage of this method is that this method is not a foolproof. That doesn't give you a 100% protection like a surgical method. Okay, in surgical method you can say that the chances of failure is very nil. But here the reverse one, the chances of failure is very high. Okay, so this is a natural method. So we have discussed all contraceptive methods: physical barrier method, chemical barrier methods, IUDs, oral contraceptive pills, injectables and implants. We also discussed the surgical method, and then we have also discussed the natural methods. Remember students, these are very important methods. From these methods, most of the times any 1 or 2 methods are always they are asking. So prepare it with its advantages, disadvantages, and also prepare a diagram in case of a surgical method, because sometimes they are only asking the diagram in a surgical method in a 2 mark. Okay, so this is called as contraceptive method. I hope it is clear to all of you. Okay, now we move ahead with the next topic, and we do a very brief short topic, and that is MTP. So let's start with another topic in reproductive health, that is MTP. What is MTP? MTP means, M means medical, T means termination, and P means pregnancy. Okay, so the full form of MTP is medical termination of pregnancy, is called as MTP, medical termination of pregnancy. Okay, that means a termination of pregnancy by some medical expert, okay, or medical professional. This is called as MTP, or in simple term you can also call it as, it can also be called induced abortion. Okay, it is induced abortion, means abortion that is induced by a medical professional, that is called as medical termination of pregnancy. Okay, every year if you see in the world how much MTPs are performed, every year 45 to 50 million MTPs are performed in a world. Okay, you know the meaning of millions. 1 million is 10 lakhs. You see 45 to 50 million MTPs are performed in a year in the world. Okay, that means that is a very huge number. That what it indicates, 1/5 of a birth, whatever the number of birth, from that 1/5 of them has been aborted medically. That is called as medical termination of pregnancy. Okay, this procedure has to be performed or not. Okay, that is a kind of a subject of debate, means whether abortion has to be done or not, that is a kind of a debate subject. But in India, this MTP has been legalized, okay, by a law that is called as MTP Act, which is passed in a parliament in 1971. Okay, so now in India there is a prevalence of an act called as MTP Act 1971. Okay, it's called as Medical Termination of a Pregnancy. The termination of pregnancy has a certain issues. It has some kind of emotional issues because the lady who conceives becomes a pregnant. The baby which is growing in her womb, so she is very emotional towards baby. Okay, there is some also kind of a social issues. There is also kind of a religious issues. Lots of issues are associated with it, MTP. Even in India, there is also a problem of female foeticides, because you know that in most of the people mind there is a one belief that in society most of the people mind is that they want a baby boy instead of a baby girl. So if they found that the baby girl is growing, so they kill them. That is called as a female foeticides, and so that's why the strict implementation of MTP has been done in India. Okay, that means what these laws says that according to a strict implementations, no one can even check sex of a baby. Okay, we have a technique called as amniocentesis and a kind of instrument called as an USG through which the sex of a baby can be determined, because you know that at the end of first trimester or at the end of 12 week or at the end of 3 months, the genital organ appears, and that is very clearly seen through a sonography, but that we can determine. Okay, but the killing of that female girl has been banned, and even the sex determination has been banned in India by implication of this MTP Act. Okay, so no one can kill or abort the pregnancy, okay, until the following cases. Okay, abortion or medical termination of pregnancy is only allowed in certain circumstances. So which are the circumstances in which MTP is allowed? The first case in which MTP is allowed, the first instance in which MTP is allowed, that is if continuation of pregnancy endanger life of fetus or mother or both. Clear? So that means if there is a pregnancy continue, then it may leads to a, you can say, a difficult time for both baby, that means fetus, mother or both. That in that circumstances MTP is allowed, means induced abortion is allowed. Okay, so if there is a risk of a life of a fetus or a mother or both, so in that circumstances only that MTP is allowed, but the doctor will decide whether the risk is there or not. Okay, so this is the first case. The second case where MTP is allowed, MTP is allowed if you can say that the pregnancy is the result of rape. In this case, the MTP is allowed. This is the unwanted sex. Okay, the rape is an unwanted sex, and if the pregnancy arises due to this, then in that case the MTP is allowed. Third case, okay, in which MTP is allowed, if there are chances, if there are high chances of baby were born physically, or you can say simple language, if there are very high chances of birth of physically and mentally challenged baby. Okay, or you can say a mental defect, mentally defective baby. if the baby which is going to be born is either, there are chances that may be either physically or mentally defective, because through a now various kind of a diagnostic procedure we can come to know that the baby is healthy or not, okay, physically or mentally. And if there are chances that if there is a serious chances of the baby born is physically or mentally handicapped or mentally and physically defective, in that case the MTP is allowed. And the fourth case where MTP is allowed, that means the pregnancy is due to a failure of contraceptive method, because most of the contraceptive methods does not provide a foolproof protection, okay, only except the surgical method where foolproof protection is applicable. But in most other methods the chances are that there are 1 to 5% chances are that the pregnancy may result, and that is called as a failure of contraception. So if the pregnancy arises due to a failure of contraceptive, so in that case the MTP is allowed. So these are the only 4 circumstances or the grounds on which the pregnancy or MTP is allowed. Otherwise the MTP is not allowed, and there is a strict implication in India. So where the MTP is allowed, medical termination of pregnancy is allowed. If continuation of pregnancy that endanger the life of fetus or mother or both. Second one is if the pregnancy is due to a result of a rape or unwanted sex. Third, if there are very high chances that the baby which is going to be born is physically and mentally defective, so cannot able to survive its life in a normal way. Fourth, there is the pregnancy results of a failure of contraceptive devices. In that cases the MTP is allowed. Okay, so these are the 4 circumstances in which medical termination of pregnancy or induced abortion is allowed. In all other cases it is not allowed. Okay, see, remember, this has to be performed by medical professional or medical expert. Do not has to be performed by any unqualified practitioner, unqualified. Okay, so do not has to be performed by unqualified practitioner, and if it has been performed by unqualified practitioners, the chances are that may leads to a damage to a reproductive organs of a female. Okay, so always the MTP has to be performed by qualified medical practitioners only. Okay, do not has to be performed by qualified medical practitioner. Okay, now you know that MTP is allowed on certain grounds. These are the 4 grounds on which it is allowed, otherwise it is not allowed. But this MTP, when it has to be performed, the MTP is safe up to first 12 week, or you can say a first trimester. Okay, it is safe in a first trimester up to 12 week. It is a safe, okay, safe to perform. But if it is between 12 to 24 week, the growth of a baby is 12 to 24 week, then it is somewhat dangerous. Okay, so at least 2 doctors should be of opinion of these 4. Okay, if 2 doctors agree on these 4 ground, then and then it is allowed. In up to 12 week, if only 1 doctor agrees, then it is allowed to perform the MTP. But between 12 to 24 weeks, only 2 doctors have a same opinion that MTP should be performed. Then and then the MTP is allowed. Okay, so that is MTP, medical termination of pregnancy. Usually in our country we are not performing the MTP beyond 20 weeks. Okay, in rare circumstances we go beyond 20 weeks. Okay, otherwise the MTP is not performed beyond the 20 weeks of pregnancy. Okay, because it is not safer after 20 weeks of the baby has been grown much larger, so it is very difficult to perform the MTP because it may affect or keep a danger on a life of both a fetus and a mother, specifically a mother. So this is about MTP. Again, it is very important topic, MTP, medical termination of pregnancy or induced abortion, how many performed, when it is legalized, whether it has to be accepted or does not accepted. That is a kind of a debate subject because lots of emotions, social, religious issues are associated with it. Some countries have accepted it, some countries doesn't have accepted it. In India, we are living in India, so I just talk about the India. In India, the MTP has been legalized in 1971 because it's a law, and in these four circumstances only the MTP is allowed. In the first trimester, it is safe to perform the MTP. In between 12 to 24 weeks, it is you have to take opinion of two doctors, and if two doctors agrees, then it has to be performed. Normally, the MTP is not allowed beyond the 20 weeks of pregnancy. So that's all about MTP. So today we have discussed two most important topics: the methods of contraceptions, and the second one is this is MTP. Okay. So students, keep learning, keep watching, like and subscribe this channel. Thank you for watching. Okay, thank you once again.